All right, Paul, thank you. Dawson's Creek actor James Vanderbeek revealed earlier this month that he has stage 3 colorectal cancer at 47 years old. He says the diagnosis came as a shock to him, and he's been using his platforms to raise awareness about the condition since cases are rising among people under 50 years old.
Joining us live now to talk about the uptick and what could be behind it is Dr. Andreas Kaiser. He is the colorectal surgery chief at City of Hope Cancer Treatment Center in Duarte. Thanks so much for joining us this morning.
Good morning. Thank you for having me.
So first of all, can you just briefly explain what colorectal cancer is and who historically has been most at risk of getting it?
So we do have different segments of bowel in our body. We have the small bowel and we have the large intestine. And the large intestine is referred to as the colon, and the last part of it is the rectum. So these two segments account for about 150 new cancer cases per year and about 50,000 cancer deaths per year.
You know, I'm somebody who has this in my family, and I go in and I get my colonoscopies, but they're not really recommended until a little bit later, 45. But the demographics have been starting to shift. What do you think is speeding up the timeline?
Well, the truth of the matter is we don't really know, but we do see that there is an uptick of cancers in young patients. Below 50, colorectal cancer is now the #1 cancer death in male patients and the second most common cancer death in women below the age of 50. The sad part is that actually we could prevent this cancer if we looked early enough. So it's very, very important that we follow like screening guidelines, but a lot of those young patients are experiencing cancer below that start of the screening programs.
So what should people look out for, maybe those who are under 45, signs for younger people who don't have this on their radar?
I've come across numerous patients who did actually have symptoms, and they went to their insurance or their primary care physicians and said, I have this and that symptom, for example, rectal bleeding, etc. And they were just told, well, you're not 45, don't do anything. And that's exactly wrong. So when you do have symptoms, then you should be worked up. The screening, the 45 age, really applies to people who have no symptoms, no family history, no risks identifiable. Then everybody should get a colonoscopy at age 45. But if you do have special risks, family history, the symptoms that you display in your screen right now, blood in the stool, change of bowel habits, pain, unintended weight loss or so, then you need to be worked up, whatever age you have. And I think that's where it's really important to be your own advocate and push for it when you feel that you don't get the attention that you should get. And just don't deny your symptoms. It's not hemorrhoids until proven otherwise.
I know. I think that's what's so frustrating for people, though, is that it is such a fight when you realize what's going on in your body, or you think you know what's going on in your body, and you go to the doctor's office and they tell you, no, screening's not till 45. I mean, we've seen this happen also with breast cancer, where the screening age has changed. Do you think the screening age needs to change with this cancer as well, as we're seeing younger and younger people getting this?
I think we might get there, but also we should not forget that we try to work in research in identifying other ways to identify the cancer. So right now we really rely on colonoscopies. We do to some degree rely on other tools like stool tests, etc., which are a little bit less reliable, but hopefully, and at City of Hope we're working strongly on that, is to identify patterns where genetic whatever changes can tell us here we have a specific risk where the cancer might actually have a higher chance to evolve in such a patient.
Well, as I indicated, I have a family history of this. I've been in for a colonoscopy. It's something that's not pleasant, but it is the best nap you will ever have if you...
I can not disagree at all. Yes, I think what is the obstacle for a lot of patients is that you actually need to clean out your colon. The cleaner you do it, the better the doctor can give you assurance, yes, there is nothing in there. If you have an incomplete bowel cleansing, then we may not see something that is hiding behind a puddle of stool, etc. So very important that we do our part, but then you get a good reassurance that you are clear or that you can actually deal with something. And that's the other point of colonoscopy, that if you do find a precursor like a polyp, you can remove that. And if we do even have a risk for colon cancer, but we look early enough, then we can actually reduce the chance that this polyp will turn into cancer dramatically by 85–90%.
Yeah, and there really is peace of mind in that. And you just indicated not only a good nap, but a good lunch afterward. Dr. Andreas Kaiser, thank you so much for being with us this morning. We appreciate it.
You're welcome. Thank you for having me.